Okay, now that we have seen what exactly heart attack is, we'll further try and discuss the causes or what are the risk factors for development of heart attack. These risk factors can be divided into two subgroups, that is modifiable risk factors, those which we can change, and non-modifiable risk factors, those which we cannot change. Coming to the non-modifiable risk factors first, the foremost and the most important non-modifiable risk factors is age. So nobody can stop us from going old. So elderly age is supposed to be the most common group for the heart attack. So elderly people are more prone for development of heart attack. But it is not anymore. Initially, heart attack used to be exclusively seen in elderly age group. But nowadays, because of the change in lifestyle habitus, the age of onset of heart attack is slowly coming down. So, but still, heart attacks are more common in elderly age group people. The second non-modifiable risk factor is sex. So, male sex is more predominantly affected by heart attacks. So, heart attacks are more common in males compared to females. Then the third non-modifiable risk factors is genetics. As we inherit the property of our ancestors, we also inherit their diseases. So, heart attacks tend to run in families. So, this is also an important non-modifiable risk factor. So, age, elderly age, male sex, and genetics. These are the three non-modifiable risk factors which we cannot do anything about. Coming to the important modifiable risk factors, these risk factors are under our control. So if we have the will, then we can try and avoid any of these risk factors. The first and the foremost important modifiable risk factor is diabetes. So diabetes is very predominant around the world, especially more in India. A person having diabetes is said to be equivalent in risk as risk as a person who already had a heart attack. So that is the importance of diabetes. So unfortunately, if we develop diabetes, it is our duty to keep it under control so that it does not cause major damage, especially to the heart. So first important non-modifiable risk factor is diabetes. Coming next to hypertension, that is high BP. This is termed as a silent killer because this goes unaware. A person having high BP usually has no symptoms. So unless and until there are regular BP checkups, it is difficult to diagnose hypertension. But this silently keeps on causing significant damage to the heart. So hypertension is the next important modifiable risk factor. Even if a person develops hypertension, he still needs to be kept under control. Coming to the next risk factor, that is obesity. Obesity is an important risk factor for the development of heart attack. So overweight, obese people have more chances of development of heart attack. Next is inactivity, physical inactivity. A person who is physically active, who does regular exercises, has less chance of developing a heart attack compared to a person who does not do any exercise at all. So physical activity or inactivity is again an important modifiable risk factor. Coming next to the lipids, that is cholesterol levels. Hyperlipidemia is the medical terminology. In common terminology, we can call it as increased cholesterol levels in the body. It is this cholesterol that gets deposited in the blood vessels that supply blood to the heart, leading to the decrease in the blood supply and finally leading to heart attack. So hyperlipidemia or increased cholesterol levels are indirectly related to the obesity and physical inactivity. A person who is more obese has more cholesterol levels in his body, and a person who is physically inactive also tends to have more cholesterol levels in the body. All these modifiable risk factors are important, but the most important is smoking. Smoking is a very, very important avoidable risk factor for the development of heart attack. So smoking will definitely lead to some health issue. If not heart attack, it might lead to cancers, it might lead to lung disorders, it might lead to any other, so many health issues can come out of smoking. So smoking is the most important and easily avoidable risk factor for development of heart attack.